Okay, anyway, good morning, everybody, and welcome to Great Day Houston. Today, we're talking about all things medical. When it comes to health, it starts with us and our lifestyle choices. Our medical experts are in the house to answer your health questions this morning. And, of course, Dr. Stephen Hotze from the Hotze Health and Wellness Center. Please welcome them to the show this morning. It's always so interesting to have each one of you on because in each of your area of study, it's amazing that there are always new things coming up. What was the practice yesterday sometimes can go away, and there's a whole new practice. Dr. Hotze and Dr. Stringola, the other thing in your areas of practice is we're getting to preventive medicine, almost like preventive medicine is the real medicine and everything else is alternative medicine. And you've been preaching this a long time, Dr. Hotze.
A long time. God's given the body amazing restorative powers, and if we put the right nutrients, vitamins, minerals, and nutrients to the body and restore our hormones, our body can heal itself.
Yeah. There's a segment that we call here where we find out from our experts certain things, and it is called, audience help me out, What's Up, Doc? Oh, very good. You all rehearsed this morning, didn't you? All right, so we took our cameras to the streets and have people ask some questions, and we'll have you all answer them.
I've been feeling really tired lately. Is there anything I can do for the dark circles under my eyes?
All right, feeling really tired lately. Anything she can do? She has dark circles under her eyes. That can be a result of a number of things.
It sure can be. First thing I always think about with patients is, what drugs are they taking? Oftentimes drugs can cause these problems. Sometimes the antidepressants, the antihypertensive drugs can cause fatigue. Other things, currently this time of year, allergies can cause fatigue, and we're in weed pollen season right now. And finally, undiagnosed hypothyroidism and hormonal decline and imbalance can cause fatigue, as well as obesity and being overweight and having poor nutritional support. All those can cause fatigue, so those need to be evaluated by your physician.
Yeah, so like having a blood test to see what's going on.
Well, really, the most important thing is to get a good clinical history and listen to the patient to find out what the symptoms are, and do a good clinical physical examination. That'll give you the indication, and then do blood tests and testing after that.
All right. Next question.
I'm not sleeping well at night, and during the day, somewhere around 2 p.m., I begin to crash. I don't know what I need to do to get my energy back.
Oh, she sounds familiar to me.
It sounds like the previous patient did. As women mature and go through midlife, they get hormonal decline and imbalances. And these imbalances can be easily corrected using bioidentical hormones. They also need to be evaluated for hypothyroidism. But in a woman in midlife, that's the first thing I think about is hormonal decline and imbalance.
Yeah, which was the problem that I had with I'd have all this energy and I wake up in the morning and all of a sudden just crash hard. Like, falling asleep at a stoplight going, hey, I got a good minute, to get some sleep. All right.
But you also have could sleep apnea be a possibility also?
Yeah, but it can be, but hypothyroidism will lead to sleep apnea, and so will the hormonal decline. That's not going to be the common problem. The garden variety problem is just hormonal decline and imbalance.
Okay, can infants get the H1N1 flu vaccine? Can an infant get that?
It really hasn't been determined yet.
One thing, we go back and look historically, we had the swine flu problem back in the mid-70s, and the swine flu vaccine caused a host of health problems, Guillain-Barré and all that, so it's not something to be entered into lightly. And I really question whether everybody ought to get the flu vaccine. You need to look at that very carefully.
Yeah,
because
but they learned from that research in the 70s.
They're still giving a vaccine, so I'd be very cautious about it.
Well, I mean, there's two sides to the coin on that.
Right, when you look at influenza and 36,000 people that die every year.
Well, this is it. Yeah. We're giving the flu vaccine, and yet 36,000 people die every year. With the swine flu, worldwide only 100 people have died, so there's been a tremendous media hype about this. So you always wonder what's behind this media hype on the swine flu.
Yeah. Are you on blood pressure medication? We certainly know that many medications can come with side effects, so wouldn't it be great if you could just get rid of the problem or treat it with someone or something safer? Okay, Dr. Stephen Hotze, the author of Hormones, Health, and Happiness, is back with us with a more natural solution. Hi there.
Hello, Deborah.
All right. This is one of those things that is almost epidemic proportions across the country, too. People dealing with high blood pressure. What is high blood pressure, and why is it so important to keep it within a certain range?
Well, blood pressure is the measure of force of the blood within our arteries. It's caused by the pumping of the heart and the resistance of the blood vessels. 31% of Americans have high blood pressure. Every year, 320,000 people will die of high blood pressure or its complications. It's huge.
Crazy. And complications like?
Well, here's the four main complications: strokes, heart attacks, congestive heart failure, and kidney disease.
Yeah, none of them good.
None of them are good. Now, the real question is, if you walk into the doctor and he measures your blood pressure and says you have high blood pressure, your first question should be, why do I have high blood pressure? Routinely, the doctor will say, well, it's essential, which means we don't know, you just got it, so you need a drug. And so they're going to put you on a drug, which we know have some really detrimental side effects. All these drugs do, because they're toxins. So what causes high blood pressure? And that's what we need to address, and the lay public can know this. Overweight and obesity leads to high blood pressure. Poor nutrition, like high sugar diet. Sugar, if you have a high sugar diet or refined sugar, carbohydrates, guess what? That raises your blood pressure. Trans fatty acids, poor oils in your system raises your blood pressure. Low magnesium levels, which is ubiquitous in America, and low vitamin D levels raise the blood pressure.
And see, those are things I wouldn't see a lot of people testing or knowing to test for.
They don't even test for. Metal toxicities, for instance, heavy metals like mercury, the amalgams in your teeth cause it. Chemical pollutants, the polychlorophenols and the phthalates that are in the plastic. They harden the arteries and raise the blood pressure. And then pharmacological agents raise the blood pressure. As a matter of fact, blood pressure, the first blood pressure medication doctors routinely give is a diuretic, which causes you to leach out magnesium and raise your blood pressure, so your pressure goes up and they put you on another medication.
Yeah, it's kind of like this daisy chain, if you will, or domino effect where...
So why don't we address the cause rather than simply treat the symptom, which means using drugs and getting all these terrible side effects.
Let me back up on some of those drugs, because people, if they're taking diuretics, you just explained to us one of the problems that can happen with that. The angiotensin converting enzyme, the ACE inhibitors.
Well, the ACE inhibitors of all the blood pressure medications tend to have the least side effects, but they're given to a lot of women get high blood pressure during pregnancy, and on the black label it says it may cause harm or even death in the last 6 months to the unborn baby. And so those are dangerous drugs, and if they're causing harm to the baby, you know they're not helping you. I mean, anytime you use a drug, it's a toxin, so it's going to cause some problems. And then you got the calcium channel blockers, which cause brain shrinkage over 5 years. They've studied that on MRI. Shrinks the brain and increases the risk of cancers about 26%. And finally, you got the beta blockers, which will cut off your ability to properly utilize thyroid hormones, so you get lethargic and tired and fatigued. That's why I always ask if somebody's fatigued, what drugs are you on? Because the drugs may be causing that.
Let's talk about some of those natural solutions. Okay, one you say is eliminating grains and sugars from your diet, eat a healthy diet, exercise, lose weight, lower the stress in your life.
That's right. Well, let me tell you, the first thing you got to do, detoxify your body from all these chemicals that are in your body. Vitamin C, R-lipoic acid, and glutathione. And then give yourself some minerals that will help relax the blood vessels, and that's magnesium, and we recommend 800 milligrams a day. Take
acetylcysteine. What is that one?
We want to use L-arginine, which causes your body to make nitric oxide, which relaxes the blood vessels. And you want to use coenzyme Q10. So those are three things people can take over the counter. So get your weight down, exercise, get rid of the stress in your life, cut out the refined sugars and the bad oils, and then get
garlic. We've heard even garlic.
Garlic can be very helpful too in lowering blood pressure. But these are some natural approaches your doctor should recommend to you before they start you on drugs.
And quickly, you're going to be in Katy. Tell us what that's going to be about.
Well, this coming Saturday, I have a health symposium on the 5 dangerous health trends that are affecting women and men in midlife. That'll be out at our Katy office.
All right. Dr. Hotze, thank you very much. You can listen to Dr. Hotze's radio program, Health and Wellness Solutions, Monday through Friday from noon to 1 on 700 AM KSEV. And for more information on the Hotze Health and Wellness Center, call this number, 281-698-8698, or go to hotzehwc.com. Be right back.